Okay, so we will go ahead and transition to our next program, which will be the University of Nebraska.
All right. So I'm going to go ahead and share my screen. My name's Brian. I'll be kind of talking about our program. Hopefully everybody can now see my screen. Are we good?
You're good.
Everybody? Okay, perfect. So like I said, my name is Brian. I am our chief resident for the University of Nebraska Medical Center, PM&R resident. I'm a PGY4. So we'll just go ahead and jump into it. So just a little bit about myself. So I'm from Idaho. Obviously, we're located out here in Omaha, Nebraska. And I'm going to be joined by 3 other residents. I'll let them kind of introduce themselves along with our program director, Dr. Weaver. So I don't know, Rohit, if you want to go ahead and introduce yourself.
Yeah, I'm Rohit. I'm one of the PGY4s over here. I'm from Northern California originally and on my way out here.
Perfect.
Sonia?
Yeah, my name's Sonia. I'm a 3rd year here. I am from Indianapolis. I went to med school at Creighton here in Omaha, and then I stayed here for residency.
Perfect. And then do we have Graham? Did Graham happen to get on with us?
Yeah, it says like they're not sharing my video because the host.
That's all right.
Or something. Yeah.
We got that beautiful pic of you though.
Oh,
Just go ahead.
Here we go. Can you see me?
Yep.
So hey, I'm Graham. I'm one of the PGY2s here at Nebraska, originally from Missouri. So yeah.
And then lastly, we have Dr. Weaver, who's our program director, and he'll be available towards the end to answer any questions. I don't know if you wanted to introduce yourself at all, Dr. Weaver.
I think you're muted, Dr. Weaver.
There we go. Yeah, hey, Mike Weaver, program director. I just want to say thanks to PM&R Scholars for hosting this and for all of you out there joining. Got some great residents here, so hopefully we'll get some questions answered and have you guys learn a little bit more about us.
Perfect. Okay. And just put all of our contact info right here. Welcome to contact any of us with any further questions. Feel free to email us. All right. Okay, so just a little bit of outline of what we're going to go through tonight. We're going to talk a little bit about our program faculty member, kind of the goals of our program, what rotations we have, what training sites we have, along with our didactics, benefits, and then a little bit about Omaha, Nebraska. So this is just a picture, most recent picture that we have, obviously with the mask given COVID, and then one quick photo there without them. We currently have 4 residents per class. We are a categorical program, so all 4 years are here in Omaha, Nebraska. And we'll get a little bit into more the details of exactly what our schedule looks like. These are our core faculty members. We have Dr. Berner over here, who is our department chair. And then we just met Dr. Weaver, the program director. We also have Dr. Anderson. He runs our traumatic brain injury unit. And then Dr. Kravenhoff, who's our spinal cord injury attending, and then Dr. Voda, who's our pediatric attending for our pediatric months. Also of note, I didn't put it on here, but our program coordinator is Carrie Helmberger. She's excellent. She does so much for us. Didn't have a picture of her. I couldn't find one on our university website, but she's great, and we all really get along really well with her, and she does a lot for the residents. A little bit about our program goals. Obviously, the overreaching of the goal of the residency is to provide an educational experience of such quality and excellence as to offer its graduates opportunity to attain the 6 core competencies necessary for entry-level independent practice of PM&R. And for those that aren't aware with the core competencies, those are just kind of pictured over here, the 6 core competencies for every residency. Also goal to provide knowledge and training regarding diagnosis, pathogenesis, treatment, prevention, and rehab of neuromusculoskeletal, cardiovascular, pulmonary, and other systemic disorders that are very common to our specialty. And then provide opportunity for residents to effectively and efficiently coordinate interdisciplinary team of allied rehab professionals for for the maximum benefit for our patients. Other than that, kind of getting into the meat of the program, kind of getting into the details, going through our first year. So our first year residency, like I said, it's all categorical. It's based here. There are 6 months of internal medicine. 3 months of those 6 months are at the VA. So you're on the VA internal medicine service. You're going to have a month of ICU. You do have a month of being on the endocrine service. And then you are also on a neurosurgical co-management team at the Med Center. So that comprises all 6 months of those internal medicine. You do 1 month of general inpatient pediatrics. You do a month of acute stroke through the neurology department. Then we have 1 month of LTAC, which is long-term acute care hospital, which is at the hospital that we do all of our rehab rotations at, which is Madonna. So you'll spend a month there, 1 month with emergency medicine, and then you have a month of trauma, and then a month of neurology. So it's a really pretty good mix. Most of those are medicine-based. Obviously, you do have that 1 month of trauma in there to get you experience within the surgical realm. As far as our second year of residency, it is all inpatient rehab. We do 3-month blocks of rotations for our inpatient months. So you'll spend 3 months on the traumatic brain injury unit with Dr. Anderson at Madonna Hospital, which is the hospital we partner with. You also do 3 months of spinal cord injury medicine with Dr. Kravenhoff, and we'll talk about that. That's actually in Lincoln, Nebraska, so that's about an hour away from Omaha. And then stroke and then peds rehab, both back in Omaha. So it's a really good opportunity for continuity for our patients because you're on that service for 3 months. So you get the opportunity to see the patients from admission to discharge, and you get to see their whole rehab progress as they're here, which is an excellent experience to really see it through, to be able to see the patients from the very beginning to the end till they're discharged. And then as far as our third year of rotations, this is all going to be outpatient based. So our third year residency is entirely outpatient. You're going to do, you do have an elective month during your third year. Then you have a month that a month with our movement disorder. So that's with our neurology department. You're doing anything from Parkinson's to MS, anything that's movement disorder related, spasticity management, dystonia. You will get that all during that month. Then we do 2 months of sports medicine with Dr. Weaver and the other sports med docs throughout the university. We also spend some time with the ortho docs, some half days in the OR, getting exposure to the surgeries that we would be helped rehabbing. You get 2 months of EMG. We do have 2 months of pain medicine, which is an excellent rotation here at the university. We actually do have a pain medicine fellowship, ACGME pain medicine fellowship through our anesthesiology department, with the chair being Dr. Ari, who is actually PM&R trained. So the department chair is actually PM&R, so very PM&R friendly program here at UNMC. But got a couple good months there with pain. Then we do a month of cardiopulmonary rehab, rheumatology. We do some orthotics and prosthetics with an amputee clinic that we have, in addition to being able to get exposure with the prosthetists and the orthotists. So, and then a month of research, which we have excellent opportunities to do research here through Madonna. And then our last year. So last year is kind of a mix between inpatient and outpatient. You'll see interspersed there that you have a month of traumatic brain injury, a month of spinal cord, and a month of stroke. Those are going to be your 3 inpatient months during your fourth year, and then the rest is going to be outpatient, 2 months of EMG again, 3 months of PM&R outpatient clinics, then OCMED, geriatrics, neuromuscular, and then an elective during that last year. One thing I didn't put on any of our slides, but I'll just go ahead and mention it here. As far as our call schedule goes, as far as residents, we currently are on a every 4-week call schedule. We do all home call, so everything's from home. You do call during your second and third years, and then the fourth years do not have any call obligations. The call schedule is a little unique in that you will have 2 residents on call at a time. You'll have a primary resident and a secondary resident. The primary resident is responsible for all phone calls throughout the week. And then the secondary resident, as it currently stands, it comes in on the weekend and helps with the rounding and the management of the patients on the weekend, but otherwise doesn't have call obligations throughout the week. So it's kind of it is every 4 weeks, but it's almost every 8 weeks as far as responsibility of phone calls throughout the week. But for simplicity's sake, it's essentially every 4-week call during that 2nd and 3rd year. But as far as our call goes, it's a pretty good balance of call. Most of the calls we get are able to be managed from home. It is rare that you do have to go in, but that's not unheard of. And most definitely spend time on the weekend seeing patients, taking care of patients on the weekend. All right, as far as I kind of alluded to this, as far as our training sites, locations where we train, majority of the residency is located here in Omaha. This is our University of Nebraska Medical Center. What we're actually looking at is the medical school. So that's our sponsoring institution. These are just some more pictures, a little bit about the medical center. It's the region's only 24/7 trauma center. It is a regional leader in cardiovascular and neurosciences. UNMC does have an international reputation in oncology, transplant, and biocontainment. So some leaders in the infectious disease world. We do have a total of 809 beds. They're broken up between a Bellevue campus, which is just south about, depending on where you live within the city, anywhere from 15 to 30 minutes just south of Omaha, essentially just a extension of Omaha. So that has 91 beds, and the actual med center, which we can see below here on the bottom right picture, is where we have majority, which is 718. We have a comprehensive stroke center. We talked about the acute stroke month you have, so very good exposure to acute stroke. They have congestive heart failure certification, ventricular assist device certification. So that means that as far as rehab, we do see a lot of LVAD patients in the rehab setting. So we get a really good exposure to the management of LVADs in the rehab setting. And then we also have a lung transplant program certification through the Med Center. So that also means we get a lot of transplants. So we see a lot of kidney and liver transplants, actually. We do see the occasional lung transplant come through, but we actually do see quite a bit of transplants that come through our rehab setting. And then as far as our exposure, so this is Madison Hospital. This is where you're going to spend most of your time as a 2nd-year resident. The picture above is our Omaha campus. So that's where you're going to spend 9 out of the 12 months during your 2nd year. And then you will spend 3 months at Madonna Rehab Hospital in Lincoln, which is located about an hour's drive west of Omaha. That's actually where the University of Nebraska is located, if you're thinking anything from their college football program. So that is actually in Lincoln. It's a pretty easy drive if you opt to commute it every day. Madonna does provide housing for those that wish to stay in Lincoln, and the housing is actually just right across the street, so you're able to walk to work if you choose that option. I'd say as of right now, a lot of us have opted to commute. But there most definitely has been a few that have opted to stay there, and most of them say the house that you stay in is adequate. Nothing wrong with it. Most of them say it's really pretty nice, has all the amenities that you would need, and they've liked not having to drive back and forth every day. But the rest of us have commuted, which really hasn't been very bad either. Some other sites that we train at, this is just a picture of the VA. So like I mentioned, you're going to spend some of your intern months at the VA doing internal medicine. You're going to spend some of your EMG time at the VA, along with neurology. Yeah, it's kind of a VA EMG month with a little bit of neurology over at the VA also. General neurology, that's what I was thinking of for the intern year, is over there also. And then here's Children's Hospital. So you'll spend time at Children's Hospital during your intern year, and then a little bit during your 3rd year, or during your 2nd year, excuse me. During your PEDS month, Dr. Bodo does a clinic at Children's Hospital in addition to rounding on the inpatient rehab unit at Madonna. One thing I'll backen up just a little bit. One thing I didn't talk about, Madison Hospital, each unit that we round on, so we have a specific traumatic brain injury unit, specific stroke unit, and a specific spinal cord and specific peds. We also do have a cancer rehab unit / general rehab. Each unit has 16 beds.
And about 5 minutes left.
Oh, okay. So that kind of gives you that idea. So quite a bit of exposure as far as that goes. We'll speed it up a little bit. We do have didactics every week, 2 hours every morning on Fridays. We do a 1-year curriculum, so you get the topics repeated 3 times during residency. Our lectures are given by attendees and staff from both UNMC and Madonna. We also have a monthly journal club. We do a quarterly M&M conferences that are given by the residents. And we also have a monthly high yield lecture that are given by the residents. And we are currently starting to develop an ultrasound didactic. We have partnered with currently the rheumatology department, but working on our own didactic schedule for that also. These are just a few of our benefits. We get 20 days of vacation. We got professional leave days for approved meetings. Conference attendance is covered by the program during your 4th year. We do have sick leave that you accrue, good health insurance. We get a $7 meal card every day for food, $300 a year education stipend. You do get white coats provided by the university. There's tuition credit that you get for employees to be able to go to University of Nebraska Omaha or the Lincoln campus or Kearney campus, what all those stand for, or even the Med Center. We do have free gym options at several locations. And then down below is kind of a breakdown of our salaries. So for living in Nebraska, cost of living is pretty low. We actually get really pretty good salaries here as residents also. About Omaha, Rohit, I don't know if you want to kind of take it over here. Rohit's kind of our guru as far as the city goes, but Omaha's a really great place to live.
Yeah, I think, my pearls, my clinical pearls, are, Omaha has the largest or the most restaurants per capita in the United States, which is super nice because I feel like I've been able to get the types of cuisine that I haven't been able to get in other cities, like Burmese food. We have actually a really good Burmese population and things like that. I feel like it's got a little bit of everything. I know you have the zoo up there, Brian.
Mm-hmm.
So I would, the zoo's like on par with the San Diego Zoo, kind of fighting for 1 and 2 in the country, which is super nice. It's got a lot of recreational activities, and I actually don't know what this is, Brian, if you want to talk about that.
Yeah, so they do the Olympic swim trials here typically. So there's excellent opportunities for sports coverage. I think they did a curling event here a while back. Lots of things come through Omaha. Lots of concerts end up coming through Omaha just because of the close proximity to Kansas City. And then obviously we have the College World Series, which is a big draw to the city. Unfortunately, did not happen this last year.
And if you want to go back one slide, Brian, sorry.
2 minutes left, guys.
I mean, I live downtown, so we're in pretty good proximity to all this stuff. So we got a bunch of cool little areas, kind of sparsely located with good food and restaurants. And he's got the Orpheum Theater up there, which plays like off-Broadway shows, and we've seen a few of those as well.
Yeah. Sorry, guys, a little overtime, but any questions real quick before we run out of time? Sonia, Graham, anything you guys want to add?
Just like to put a shout out there to Omaha, Nebraska. So when I first moved here, I thought it was going to be this random middle of the nowhere Nebraska, but I've been here for 6 years, and honestly, it has really grown on me. And don't knock it before you come here and visit.
I would just echo that. It's certainly tougher for us given that this year's virtual. Part of the draw, I think, when we get people to come interview is you get to see the city and you can kind of take it in. And now we don't have that opportunity. So I would agree. It is a good city if you find yourself here.
And as for resident activities, we just came back from a softball game. We did not fare well, but that
was a tough team.
Yeah, sure. That's why.
Yeah.
But yeah, so certainly we try to hang out and do stuff together. may not be very good at softball, but
Yeah, we most definitely all get along. I think we all know each other extremely well. I think, all the way from PGY 1s to PGY 4, we all get along. A lot of camaraderie amongst the residents. I don't think any of us are afraid to, hang out with each other, do things together. So, and then for anybody, go ahead, Redhead or
Yep.
Graham.
It's Jim Eubanks here. Yeah.
Okay.
Appreciate you guys. That was a great presentation. And if you would like, you can put some contact information in the chat
Sounds good.
window there. And thanks again.